Hello everyone, this is Dr. Hari from Cell Tissue Technology. Today I'm here to talk to you a little bit about diabetes, the food ulcers that come with them, and also the amputations that arise as an end result of this chronic disease. First of all, I would like to inform everyone that there are 3.6 million diabetic patients in Malaysia as of now. And according to our National Health and Morbidity Survey that was done recently, 1.8 million of these patients were initially unaware of their diabetic status until they developed a diabetic ulcer. Now, it is important to remember that 80% of these diabetic amputations that happen worldwide have arisen from a small diabetic foot ulcer. And the main thing that we need to consider is treating the patient holistically and preventing readmission. Now, the main modality of treatment as of now for a chronic non-healing diabetic ulcer would be a split skin graft. Split skin grafting is a simple procedure where surgeons remove part of a healthy skin in excess areas of the body, and that part of that healthy skin is implanted back over the area that requires coverage. The reason we do this is because diabetic ulcers, besides healing very slowly, their prolonged exposure to the external environment also increases chances of infection. So this main method of treatment is conceived to sort out this issue. However, using split skin grafting, we would require a healthy piece of skin from the patient. This means that the patient would have a second wound that is now exposed to the external environment. So this also increases chances of infection and the number of procedures that the patient has to go through, as well as the number of dressings that has to be done for the wound. Now, this is where our tissue-engineered human skin comes in. Using a small piece of skin obtained from excess folds of skin on the patient, we can construct a skin that is the patient's own skin, and we can make it to whatever size that is necessary to cover the exposed area. So with that in mind, we can reduce, number one, a huge wound site for the patient. Number two, we can reduce the number of procedures done on the patient. Number three, we can also reduce hospital admission time for the patient. This, in general, reduces the overall cost for managing a diabetic wound holistically. And besides that, the patient also feels significantly less pain, and there's also better cosmesis involved. So as a conclusion, I would just like to remind everybody that while we live in a time with a lot of different wounds, chronic non-healing ones, we are slowly coming up with new alternatives that are viable and both effective to treat the patient holistically. I would also like to remind everyone, in case of further information or questions that you have, you can always go to our website, celltissuebiobank.com, or you can also search our social media on Facebook and also Instagram at CellTissue Bio-Bank. With that in mind, I would like to thank you for listening and hope you've learned something today. Thank you very much.